Most people are not aware that the tactile system spans the entire body, so there can be many challenges with integrating this system. Some of the things you may see, or some of the challenges you may see with your child, are distress in clothing changes, distress in grooming activities such as brushing your teeth, brushing your hair, showering, washing your face, that sort of thing. Avoiding certain textures, again, like changing your clothes, avoiding messy play like shaving cream, sand, mud, putty, whatever it may be, avoiding some of those textures, and also picky eating. And picky eating is something that people don't often think about, but the tactile system also goes into our mouth, so we can have sensitivities there. And on the opposite end of the spectrum, we see kids that have some of that hyposensitivity. So they're seeking out some of that tactile. This may look like seeking out messy play, excessive touching, and seeking out certain textures or tastes. We also see those kids that are a little bit more daring with some of their activities, and they don't get hurt or they don't have that same pain response when we think that they should. And we also have kids that are a mixture of hypo and hypersensitivity, where maybe they're seeking out messy play but really dislike brushing their teeth. So you can have a mixture of things, and that's very common in the sensory system. In therapy, to help address some of these things, there are a multitude of different things you can do depending on what the kid is presenting with. For example, if there's sensitivity with eating, then we'll do some feeding therapy where we're slowly exposing them to different foods, and doing some touching, smelling, tasting, licking, playing, using some vibration in their mouth to help with that sensitivity. We also do therapeutic brushing where we're doing a nice deep pressure, do lots of heavy work, deep pressure activities, practicing changing in clothing, practicing brushing our teeth or our hair, and engaging in some of that messy play. So it's a lot of practice. So those are some of the things that we will do in session to kind of help address some of those challenges these kids may be facing.